Hello everyone and welcome back to my channel Physiotrendz. First of all, wish you all a very happy new year 2022. I wish that all your wish and all your ambitions come true in this new year and you become a very good physiotherapist with the help of Physiotrendz. So this is a new series of Physio Quest in which I have started giving you 2 questions in each week. So first I am going to give you and discuss the answer about the first question which came on the Thursday. Now let's first see what information we have got in the question. So the question says that a patient has been on bed rest for 4 days following complications after revascularization, surgery involving a triple coronary artery bypass graft. During the first therapy session, the patient complains of tenderness and aching in the right calf muscle. So the therapist should immediately examine for. So the options what are given to us is either option A, bradycardia, option 2 which is Homans sign, option 3 lowered body temperature, option 4 swelling in the calf or ankle. Now, according to what information has been provided, we need to understand one thing, that after triple artery bypass grafting, on the very next day, patient may get increased in the temperature because of the inflammation or may get tachycardia because of the surgical or because of the stress. So, these 2 options are already not given in the option. Instead of that, we are given bradycardia and reduced in the temperature. So automatically these 2 options we can eliminate from the options given. Rest 2 options what are given to us are Homans sign and the another one is swelling in the calf muscle around the ankle joint. So Homans sign. So what is Homans sign? First that we need to understand, which is in Homans sign we have to squeeze the calf muscle. And when you are squeezing the calf muscle, patient complains of pain, then definitely the Homans sign is positive. But again, that reliability factor and the validity factor of the Homans sign is not that good. So definitely physiotherapist should not perform that. Then the remaining option what is left is checking for the swelling of the calf muscle around the ankle. Now the reason that why we should check calf swelling around the ankle joint, because it is a clear sign of the DVT, deep vein thrombosis, and which is a very common complications after any surgery. And also clear signs of DVT are swelling, tenderness around the calf or ankle joint. So that is why this is the first thing that a therapist should check, and after that if possible ultrasound scanning should be done to find out the exact cause behind the reason. So I hope you all have understood the reasoning behind the answer, as well as you have understood that how we can eliminate other answers and find the correct answer for the same. So now let's move on to the next question which I asked yesterday, which is on Saturday, and the question, whatever the information we have got, is as following. After completing an examination of a patient with shoulder pain, the physiotherapist concludes that the cause is subscapular tendinitis. So this clinical finding supportive of this conclusion is, so we need to find out that what are the supporting factors from the option, and that will be the correct answer. So option what are given to us are number 1, which is pain provoked with active glenohumeral external rotation, option 2 pain provoked with passive glenohumeral external rotation, option C tenderness at the greater tubercle of the humerus, or option D painful resisted shoulder abduction. Now to understand the answer, first we need to understand the question here. The question which is asked is that therapist has confirmed the diagnosis which is subscapular tendinitis. Now you tell from the following option which can be the supportive statement. Okay, so the first statement is external rotation which is performed actively. Now we all know that active external rotation is a work of supraspinatus and not subscapularis. Subscapularis, instead it performs the internal rotation because of its origin and insertion. So that is why that option cannot be correct. Second option what we have got is painful passive external rotation. So now this makes sense because as I told you, subscapularis is the internal rotator. And if I want to put more stress on the internal rotators, either I can perform internal rotation with resistance or I should perform passive external rotation. Just like small example I will give you, that if a tendinitis is there, lateral epicondylitis is there, we perform Cosen's sign. In Cosen's signs, what we exactly do is either we perform passive flexion at the wrist or we ask patient to perform resisted extension at the wrist. So same way, if internal rotators are involved, I'll either go for passive external rotation or resisted internal rotation. So here the option is given that passive external rotation is painful. That makes more sense to me, which can be the correct answer. Other two options also let's discuss. The third option is palpation on the greater tubercle is painful. Now again, if it is on the greater tubercle, subscapularis is not attached somewhere near to the greater tubercle. So why there will be painful? So that option also eliminated. And another option is abduction, resisted abduction of the shoulder is painful. Again, subscapularis has nothing to do with the abduction of the shoulder, and resistance to that is not going to provoke the symptoms of the subscapularis muscle tendinitis. So that is why the second option is the correct one, which is passive external rotation at the shoulder joint. I hope you all have understood this, both the answers for the question. Still, if you have any queries, do let me know in the comment section, and also let me know how much you are enjoying this physio quest. Thank you so much.